Production support for InFocus is provided by Smithville, a locally owned business serving central and southern Indiana since 1922 with residential and business internet, voice, and security services. Smithville, local pride, global technology. Information at smithville.net. Hoosier Energy, providing electricity for central and southern Indiana electric cooperatives and their member customers. Information at hepn.com. And by viewers like you. Thank you.
There are millions of impoverished Americans, and the fastest growing segment of the homeless population is families with children. In January, the United States Department of Housing and Urban Development awarded $1.4 billion to nearly 7,000 local homeless assistance programs. Indiana experts say housing is the most immediate need for the homeless, followed by creating prevention programs to reduce the chronic nature of the problem. Tonight, we put homelessness in focus. And thanks for joining us for this edition of In Focus. I'm Stan Jastrzebski. If you have questions for one of our studio experts during tonight's program, please email us at infocus@indiana.edu or call us at 1-800-987-9848. Homelessness can result from a lack of work, low wages, or increasing medical care costs. And my co-host tonight, WTIU's Shamika Neely, reports on some alarming homelessness statistics and explains what government agencies are trying to do to combat the issue.
On a given night, the United States Department of Housing and Urban Development estimates 730,000 Americans are homeless. In January, HUD distributed nearly $14 million in funding among 110 local homeless assistance programs in Indiana as part of the Obama administration's Opening Doors strategy aimed at ending homelessness. With a continued focus on education and health care reform, is homelessness an important issue to the government?
There are lots of different pressing demands on government these days, and it seems to me that one of the areas the government is most needed is in helping those that are most in need. And if our government isn't going to be in a position to help those that actually are without a place to live, then it seems to me I'm not quite sure what the proper role of government is. That's not to say that government has to do it alone.
The United States Code defines homelessness as lacking adequate housing. 3.5 million Americans each year experience homelessness. Reingold says further research is necessary to determine what factors lead to people becoming impoverished.
Most of the research and what we're learning now about the risks of becoming homeless, particularly among families, is that what matters, what seems to be the trigger for homelessness events is less a condition of the local economic environment or of the local housing supply and the cost of the housing and those sorts of dimensions, but much more a function of the dynamics of families, family breakup, the prevalence of mental health.
HUD also reports 770,000 homeless children are enrolled in public education systems, part of a growing number of families with children who are without homes. Their stories and hope for government intervention tonight as we put homelessness in focus.
Good evening, I'm Shamika Neely. In just a few moments, we'll be speaking with Joel Rikas. He's the Executive Director of the Shalom Center. That comes up in just a bit. Right now, Stan, back to you.
Thanks, Shamika. Joining us here in the WTIU studios tonight are Dan Combs. He's the trustee for Monroe County's Perry Township. Also, Director of Independent Living with Human Services Incorporated, Susan Lamborn, and Dr. Kathy Byers, who serves as a program director in the School of Social Work at Indiana University. Thanks to the three of you for being here. I want to start with what sounds like a basic question, but one that may not have a basic answer. We said a couple of times in our prepackage there that one of the fastest growing areas of the homeless population is families with children. I'd like an answer from each of the three of you. Dan, we'll start with you and go down the line. Why do you think that might be?
I tend to disagree with the gentleman who said it wasn't local economic situations. Housing costs. Bloomington has the lowest wages, the highest housing cost in the state. A single parent cannot do that. It's just that simple. Unless you have a very high degree or a very high set of skills, you just cannot keep a household going in Monroe County.
Is that it? Do you think that it's high costs and it's low wages? Is it that simple an equation?
I think that's very true. I think in the last 18 months we've seen with the economy, what's happening in the economy, people show up at our doors that never showed up before. And we have seen an increase in the amount of shelter people, families, that we're seeing in the last year. It's gone up at least by 15 families.
Are you getting the sense, Dr. Byers, that it's that way with people who are seeking help? Are the people who coming to you more single parents, as Dan described, things like that?
I think I too agree with Dan and kind of disagree with what Professor Reingold said. Well, homelessness is very complex, and there are a number of factors that could operate in determining whether I become homeless or not. A lot of it has to do with the environment that I'm living in, as Dan said, and the cost of housing and wages. And a lot has to do with my support system that I have. Do I have family who can take me in? The homeless numbers that were quoted are really not accurate because they do not count the number of families who are doubling up and who are living with friends and relatives, moving from place to place, trying to have shelter, but it's not a permanent home.
I did wonder about those numbers. I mean, it would seem to me that it's very hard to measure the homeless population and the needs of all of the people who comprise that population. I'm curious what each of you might do to make those numbers more accurate and give us a fuller sense of how big the problem is and what it would take to solve it. Dr. Byers, why don't we start with you on that one?
Well, the research that's currently being done, we do a point in time where on a given night, usually in January, we try to count how many people are in shelter, how many people are in the typical places where people go under railroad trestles, to use kind of the stereotype, but where do people go when they really are outside living? But we don't count in that count the families who are doubling up, the children that we know about in public schools who are, every month they're moving to a different school because they're in fact homeless. And so somehow we have to compile all of those figures from a lot of different areas to be able to get a complete picture of the extent of the problem.
Susan, any thoughts on how to do that?
Well, I know in our county this year, in Bartholomew County, we are going to conduct a point in time in June because of what Kathy is saying. It's usually the coldest day of the year when we have to go out there, and we do teams, but to find out how many people are living in tents. Now, HUD does not allow us to count people that are moving in with family and friends. And now we count the average person that comes into shelter has been in 7 different households within the last 6 months. So we do know that people that are homeless, they go stay with friends, they go stay with family, and they simply can't, those family or friends just can't have them there anymore because of their economic situation.
And Dan, what do you hear about when people come into the Township Trustee's office and say, I need help from you?
The definition of homelessness that we were given was lack of adequate housing. It goes far beyond that. It's people doubled up. It's also people in bi-week rental situations. We have a motel in our township has 60 units rents by the week, and at the end of the week you're out if you don't have any money. We consider those people homeless because unless they have an income and can pay the rent, they're homeless. We want to see people in our house before they actually hit the street when they're doubled up, there is some kind of family disturbance, or they're in that hotel. We want to see them while they still have a roof over their head, even if it's not theirs, because you can kind of stabilize those people a little bit quicker than if someone is just out on the street. That's a huge investment to get someone off the street into a place, and local funds won't cover it.
I want to get back to this discussion in just a minute. Right now, though, we need to go over to Shamika with Joel Rikas.
Thanks, Dan.